What's going on in New York City? Health officials are scrambling as a cluster of Legionnaires' disease continues to grow, raising serious concerns across the city. As of now, at least 58 people have been sickened, and 2 have tragically died from the outbreak. This isn't just another routine health scare. This is a potentially deadly illness that spreads through contaminated water systems, and it's hitting one of the most densely populated cities in the U.S. fast. The affected neighborhoods are on high alert, and city health departments are launching a full investigation. So, what exactly is Legionnaires' disease? Where did this outbreak start? And most importantly, what are city officials doing to keep residents safe? Let's break down the facts and get you up to speed on everything you need to know about this developing story. First things first, what is Legionnaires' disease and why is it so dangerous? Legionnaires is a severe form of pneumonia caused by inhaling water droplets contaminated with Legionella bacteria. It's not spread person to person, but it can be picked up from cooling towers, air conditioning units, showers, fountains, or even hot tubs. Basically, any water system that isn't properly cleaned or maintained. The symptoms include coughing, shortness of breath, fever, muscle aches, and headaches. It can look like a regular respiratory illness at first, which makes it tricky to catch early. The disease is especially dangerous for older adults, smokers, and people with weakened immune systems. Left untreated, it can become fatal, as we've already seen in this current NYC cluster. According to the New York City Department of Health, the majority of the 58 confirmed cases have been concentrated in a few areas, with officials actively testing water systems in and around buildings in the affected zones. The investigation is focused on identifying the source of the bacteria, which could be tied to cooling towers or large building HVAC systems. Residents have been advised to seek medical attention if they experience any flu-like or respiratory symptoms, especially if they live or work in the impacted neighborhoods. The city has dispatched teams to inspect and disinfect potential sources while issuing alerts through local clinics and hospitals. It's a race against time to find and neutralize the outbreak before more people fall ill. Understandably, this outbreak has sparked concern among residents. With memories of past public health scares still fresh, New Yorkers are taking this seriously. Many are avoiding unnecessary water exposure in public areas, while building managers are being urged to check water systems and conduct emergency cleanings. The Department of Health is offering free testing for water systems in the impacted areas and encouraging landlords to comply quickly. So far, most reported cases have involved people over the age of 50, with some having underlying health conditions. City officials are also reassuring the public that the water supply itself is safe to drink. This is about airborne water vapor, not your tap water. Still, the message is clear. Stay alert, stay informed, and don't ignore symptoms. The city's investigation is still ongoing, and officials are working with the CDC to determine the exact source of the outbreak. They've promised more updates as lab results come in from tested cooling systems and building inspections. In the meantime, health departments are urging calm but caution. This is a serious outbreak, but it's also one that can be contained with proper public health protocols. For now, New Yorkers are being asked to monitor their health, report symptoms early, and follow safety updates from the Department of Health. As this story develops, we'll continue bringing you the latest on the outbreak, the city's response, and what it all means for residents. Don't forget to like, subscribe, and stay tuned for more updates from around the country and right here in New York City.